Well, cases of the flu and RSV are overrunning hospitals across Middle Tennessee, and patients who can't get into hospitals are now going to urgent care clinics to treat those symptoms.
News 2's Miranda Whittington spoke to the CEO of an urgent care system here in Nashville about how they are handling this surge.
3 weeks ago, we were probably 30% less busy than we are right now. So we've really seen an uptick here in the last 2 to 3 weeks.
Urgent cares across Middle Tennessee are starting to get even busier this fall.
We are really seeing an uptick over the last 2 to 3 weeks in the flu activity and the number of people coming in with flu and positive flu tests.
Dr. Ty Babcock is the CEO of Complete Health Partners. Says the 3 urgent cares he operates across Nashville and Hendersonville are starting to see their fair share of patients, particularly those with the flu.
It feels a lot more like flu season typically would feel. What's weird about it is it's October instead of December or January when typically we would see it.
With hospital systems swamped with patients, Babcock says patients are starting to make their way to more urgent care clinics instead. RSV is hitting the state hard, but Babcock says their clinics aren't seeing as many cases. But when we reached out to Vanderbilt, they told us their children's hospital has seen an uncharacteristic increase in cases. Vanderbilt says that, along with an early flu season and other illnesses, have resulted in a surge in their hospital admissions and ER visits.
I think the unknown is what's hard.
Babcock says that, along with staff shortages, are things he's having to focus on as they continue to see more patients.
There's really been a shortage at all positions, and so trying to know how much do we need to hire, how much can we hire is kind of complicated as well.
And as they continue to navigate this busy season, Babcock has one important piece of advice for the community.
If you're sick, stay home. You know, if you're going to work sick, other people are going to get sick, which we talked about downstream effects earlier. You know, has a lot of downstream effects. So.
Babcock is also encouraging people to get their flu shots as well. He says getting the COVID vaccine is something the CDC still recommends and can be helpful for those who feel comfortable getting one.